Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre, and I wanted to talk to you about a question that I'm often asked, and that is, what's the difference between different chiropractic techniques, and do they work, and how do they work, and why do chiropractors use different techniques? Well, I want to talk about the top 3, maybe 4 techniques that chiropractors use, and we use a variety of techniques in our practice, and the different techniques and why do we use different techniques, and what are they appropriate for, and how do they work. So basically, chiropractors, we look for a disease process that affects the spine called subluxation, and that's where one of the vertebrae in the spine, or multiple vertebrae, stop moving properly. So as a chiropractor, we want to restore normal movement to a joint, and there's lots of ways we can do that. And one of the first ways we can do that is doing what we call a chiropractic adjustment. And it's where we apply a very fast force into a joint, but over what we call a low amplitude. That is, the joint doesn't move very much, but it moves incredibly fast. So it's a very safe way to adjust the spine, and a highly skilled chiropractor can deliver a very fast adjustment into the joint, but over a very short distance. So there's none of this big twisting and turning that might go on in the movies that you might have seen. A chiropractic adjustment is incredibly gentle because it's delivered at a very high speed over a very short distance, and it causes the joint to move and does some amazing things in improving joint function and improving the brain's ability to understand what's happening around the joint by stimulating nerves and muscles, and it's a very, very cool thing. So that's the chiropractic adjustment. The second type of technique that we may use is what we call a chiropractic mobilization, and that's literally where we stabilize the spine and we put it through some gentle kind of side to side movements, often a figure of 8 sort of pattern, and it just gently starts stimulating some motion back into the joint, causing the joint to start producing some lubricating fluid and gently stretching the capsule around the joint and stretching the muscles, creating some blood flow in through the tissue. And it's very, very effective for patients that might be in quite a bit of pain or quite a bit of discomfort in restoring the joint's movement. The other technique we use is what we call drop piece, and if I get a chance I might put a small clip up in the corner of the video to show you what I mean. But a drop piece it's a special table that allows us to move the spine a very short distance, then we apply a very gentle force into the spine and the table just drops a tiny little amount and it causes a little impact into the joint, kind of like a tap into the joint, and restores some joint movement. So many chiropractors use what we call drop piece tables, and we have drop piece tables in our clinics that we use on some patients. And the other technique, of course, is activator. An activator is it's a special little instrument which is designed to deliver, again, a very high speed tap into the joint, and again over a very short distance. So the activator, often people call it the clicker, because it makes a clicking sound. And what it does is, as we pull that back, it loads up a spring and then delivers a tap into the joint, creating movement back into the spinal joints. So there's 4 different techniques that we use within our practice to help correct abnormal joint movement. And depending on the skill of the chiropractor, depending on the condition that the patient is presented with, depending on the level of pain or discomfort the patient might be in at the time, the chiropractor will use an appropriate technique to help correct the abnormal joint movement. So I hope that explains why chiropractors use different techniques and the different range of techniques that we have. In our practice, we have all 4 different techniques, and so we always tailor our technique to suit the patient and their condition. So remember, look after your spine. I'm Dr. Ben from Mornington Peninsula Chiropractic Centre.